Hello and welcome to Carnivorist Chats. My name is James, your host. I started this podcast to help other folks share their own healing stories and to interview thought leaders and experts in the carnivore, keto, and low oxalate space. Before we begin, I'd like to give a shout out to Equip Foods and the Carnivore Bar. As an affiliate, you can use the link in the show notes to get a discount on their products when you check out using the code Carnivorist. Thanks in advance for listening, subscribing, and any likes or shares. And now, on with the podcast. Hello, everyone, and welcome again to Carnivorist Chats. It's season 4, episode 2. The guest today is a dear friend of mine, and I've already appeared on his podcast, the Desi EM Podcast. I have Ankur Verma, who is an emergency medicine specialist for about 18 years now. He's a carnivore. Welcome to Carnivorist Chats, Ankur Verma.
Thank you so much, James. It's an absolute honor to be on your podcast today. We've had some really nice, interesting talks before regarding carnivore. I've been looking forward to our conversation today for the Carnivorist Chats.
Thank you again for taking the time out of your busy schedule. I know you're an emergency room specialist. You're on, I believe you're in New Delhi, correct?
Yeah, that's right. Yeah.
And the time difference we are now, I know it's in the evening for you. So thank you again for taking the time out of your schedule to chat with me. Ankur, let's dive right into it because I know my listeners are going to be really intrigued to hear your story, especially as a doctor and an emergency room doctor, into how you found this way of eating initially. How did it all come about? How did you start to come to the carnivore diet and see the successes that you have?
So let me start like 40 years back. When I was a kid, I was always an omnivore, but I was always inclined towards my meats. I remember my mom and my family members used to tell me that, I would go into the kitchen and ask for fish, or, I would cluck around if I wanted to have chicken. So that's how much I love my meats. But then obviously as we grew up, junk food happened, and obviously there was a lot of carbohydrate intakes also, because as the standard Indian diet goes, you got to have your meats with your rice and your rotis and chapatis and your breads and all of that. So obviously that was going on, and the junk food happened. I started working out in 2006, and then by 2021, I was 86 kgs, and I thought I was fit, because I always thought my weight is more of muscle weight rather than fat weight. But then I got a big jolt when I checked out my lipid profile, and my triglycerides was 600, and my TG to HDL ratio was 16. So, I understood that I was not well at all from inside. I still hadn't, stumbled upon what metabolic syndromes were all about. We knew a little bit as doctors, but we were never taught regarding metabolic syndromes properly in med school and what it's all about. Even if we were, obviously, we were told that you need to get onto medications for the same. And I didn't understand the TG to HDL ratio till I read Robert Lustig's book called Metabolical, which actually opened my eyes and my brains to metabolic syndrome. And then I started doing my research, because I figured that we were never taught nutrition in medical school. And I mean, the Indian diet that I was having, obviously I'd heard about the balanced diet, eat everything in moderation. My trainers, I used to actually tell me, eat whatever you want, however much you want, because you work out so much, get in your calories and your calories and your calories. So probably once I started doing a little bit of calorie counting, because I wanted to cut down my weight, after the surprise I had with my triglycerides, I figured I was having close to 4 to 5,000 calories a day anyways, with my meats and my carbs and the sweets, the Indian desserts, fully loaded with sugars. And I was like, yeah, that's not right. It took me about 9 months to actually cut down. Unfortunately, I actually had to cut down on my red meat also, because that was still the myth running around in my head. With my cardiologist, they put me on some antihypertensives and statins also, because my LDL was also high. I used to have my meats before that. But then July 2021, I cut off red meat. I cut off all sugars and processed foods. And then I realized that I was not addicted to them, because I didn't miss them, which was a good sign. And then, I was doing ketogenic. Basically, I was doing my calorie count. I was having high proteins. I was having high fats, like my eggs and all, but still avoiding red meat for about 6 or 7 months. And then somebody sent me a reel of Paul Saladino, and then I was like, okay, fine. I'm very close to carnivore, because I love my meats. This is not going to be very difficult for me. But then I started doing my research. Uh, it's not that I followed people and I just followed them blindly. I actually went into the research. even if they spoke about any article that came out, I would read through that, and then I would read through all the references, download all the papers. Being a doctor, it was not very difficult for me to understand the science. And then it struck me that a lot of the science was actually something which was actually taught to us in medical school. Things like, Krebs cycle and gluconeogenesis and glycogenolysis and all of that. But we were never taught how to use it practically onto our bodies and how it actually affects our nutrition and our diet and our metabolic health. And I realized that this is the way to go. I did my research. I've gone through a lot of papers. I've been seeing it in my department also as to how the carnivore diet actually changed my health. My head of my department's health. He's also started following it now for the past 4 or 5 months, and he's lost quite a bit. He's off his antihypertensives now. It took me 6 months to get off my statins and antihypertensives. So in like 9 months, I lost 21 kilos. And then last year, April, I went full on carnivore. So yeah, it's more than a year now. Uh, I figured out all the metabolic tests that I want to get done through research. Obviously, I then went through Robert Lustig, Philip Ovadia, all of them, all the big doctors, Dr. Ken Berry, Anthony Chaffee, Sean Baker, and I made my own list of a metabolic profile. And I do that every 6 months, which also includes your elastography for your liver. We've got the new MRI scan, which actually tests your visceral fat, just like Sean O'Mara talks about, calcium scoring and all of that. So I get that done every 6 months, not the CT at least, because I don't want to be radiated too often. But the rest of the tests every 6 months. And yeah, I mean, things are going smooth. My TG to HDL ratio is now 1.6. My wife was diagnosed with hypothyroidism a couple of months back, and she used to love her almonds. She was a carnivore, but she used to eat her almonds every day, morning and evening. Yeah. And I told her that, you have two options: either I put you on medications or you just let go of the almonds and you should be fine. And it took a month for her to reverse hypothyroidism. But yeah, so I mean, here we are, and there's still a lot of work to do because I've realized two things. I realized one, a lot of vegetarians in India, 95% of the population is vegetarian. The very high rates of metabolic syndrome, people who've actually been diagnosed, about 30% of the population, which the systematic reviews have actually published. And then there are another 30%, which I'm pretty sure are pre-diabetic or would be having metabolic syndromes, but they never get tested, right? So we have a lot of patients, and in medicine, we say if a patient comes in, they have no known comorbidities, right? They have no known illnesses from before. That's because they've never been tested, most of them. So you don't know if they have an underlying disease or not. And because they don't get tested, they're still going on with the standard Indian diet. And someday they come into us with a heart attack or a clot in the brain or in the limbs or anywhere else, strokes, but diabetic ketoacidosis. Just one fine day they come in with diabetic ketoacidosis and we see our sugars are like 500. They're like, I never had diabetes. I'm like, how do you know you never had diabetes? So yeah, I mean, I'm gonna pause over there. That's my carnivore journey, and this is gonna go on. So it's not a diet anymore for me. It's a lifestyle, and that's what I'm going to pursue. And a lot of people have this question: how are you going to sustain it? It's going to harm you in the long term, and all of that. I'm like, if it's going to start to harm me, I will know. I will catch that because I test myself every 6 months. It's not like I'm just sitting and waiting on for the next 4 or 5 years or something like that. I test myself every 6 months. I mean, you guys do annual checkups. Some of you don't even get checked up.
Thank you, Ankur. That's a very important point that I think we need to talk about. I heard you say on a podcast that some people don't get tested because they fear needles, but what's the result of that? They're going to get an even bigger needle down the line if they don't get tested. And what I appreciate about you is that you've done this testing 6 months, a year out, and you're seeing the results. And as a physician, it speaks volumes because I know a few other physicians in the area, they haven't been as forthcoming with their results. However, others have as well, but your focus on testing, test, don't guess. It's so important, is it, for everyone, right?
Yeah, absolutely. I mean, I mean, there are a lot of people who actually say, no, if you feel good, you should be doing well. That's still, that's still a lot of guesstimate. A lot of people, a lot of vegans like you yourself, when you turned out, when you started off with vegan, you were feeling really well, but you don't know what was happening inside you, right? And same goes away. There are a lot of people who in their 30s and 40s who don't get tested because of two reasons. Again, they're scared of what comes out. What if something happens, or what if something comes out positive? And the second is, I'm still 35, 40, nothing's gonna be wrong with me, and they don't understand. They've been on this diet for decades. it's going to hit you when you're 35, 40. That's how it's coming down, right? All these illnesses, they used to be age related, that's what we were taught in medicine, like diabetes, hypertension, heart disease. All of these were diseases of the old age. Like people would get in their 80s and 90s. Now it's happening 17, 18, 20-year-olds, 30-year-olds, all of these guys. I had a 35-year-old doctor who was a pure vegan come in with a stroke, and he came out of window period. He couldn't, I mean, we couldn't thrombolize him because he was out of the window period. And the neurologist was asking me, I don't understand. He's so young. Why is this happening? I asked him, did you ask him what he eats? He's a pure vegetarian. He eats only healthy. I'm like, okay, fine. Get these profiles done. His vitamin D was low. He was vitamin B12 deficient. His homocysteine levels were really high. And that's enough for them to understand if the homocysteine levels are really high, you are going to get clotted anywhere in the body. And the neurologist like, I think you've got something going on over here. I'm like, yeah, I know that.
Ankur, let's delve into specifically now on your emergency room practice. I know you just mentioned that there's a lot of metabolic syndrome presenting in your emergency room. First of all, for the listeners that may not understand what some examples of metabolic syndrome are, I wonder if you could give them. You touched on a couple there, but if you could give them, and also what you have been doing in your emergency room to assist, because I'm so proud of you for this, man. This was awesome, because I remember as a vegan, I had a hospital stay for, it was a little lengthy, a couple of weeks, but I had passed out and they were trying to find out what was wrong with me. And I gave myself a concussion and they're checking my heart and checking all my vitals. But I remember the food they were feeding me in the hospital at the time. And I was like, it was almost akin to junk food, really. It was not, now that I know what is healthy. So you've made some significant changes in your emergency room. So talk to the people about metabolic syndrome examples and what you've made in changes.
Yeah, so metabolic syndrome is basically a syndrome of different diseases. You have pre-diabetes, starts with pre-diabetes, you have diabetes, you have hypertension, which is high blood pressure, uh, some changes in a lipid profile, and we're not talking about LDLs over here. We're talking about high triglycerides and low HDL levels. A lot of people know that HDL is cardioprotective. Yes, it's cardioprotective, but when it's on the higher side, it's also cardiodestructive if it's on the lower side. So people need to remember that, right? Then you have fatty liver, and you have more of non-alcoholic fatty liver these days than alcoholic fatty liver disease. So yeah, a lot of people I know who don't drink alcohol have non-alcoholic fatty liver disease. You can have fatty pancreas. Cancer is really, really important. A lot of cancers are metabolic syndromes now. Mental health disorders, ADHD, autism, Alzheimer's, dementia, Parkinson's, they're all, all the research is coming out that these are all metabolically related. If you look at the women, you have PCOD, polycystic ovarian disease. So all of these comprise metabolic syndromes, even hypothyroidism. A lot of people have hypothyroidism, especially in India. A lot of people have hypothyroidism. So yeah, and we're seeing all of these patients come in with complications. Even if you have something called an aortic dissection where your aorta just rips apart, that's because of high blood pressure. So that's high blood pressure is again metabolic syndrome. You have brain bleeds. A lot of people have brain hemorrhages. That's again one of the causes is high blood pressure. High blood pressure is a metabolic syndrome. You have myocardial infarctions, which are heart attacks. A lot of them come in, and a lot of young people are coming in who think they have nothing. They come and tell us that we didn't have anything, but when you get them tested, they were actually metabolically ill. So they come in. So one of the changes that I did in my department was for my patients was banning all sugars and processed juices for the patients who are staying in the emergency department. Anybody who gets coffee, so we have a barista upstairs. So anybody who orders coffee, even if it's a doctor, a patient, or the relative, the guy who's getting the coffee knows he cannot enter with a sachet of sugar with the coffee. If anybody is asking for sugar, they're going to, send them over to me. And then I counsel them regarding sugars. I'm like, not in my department, that's not happening. And then they get a small class on sugars and metabolic syndrome so that they understand. I mean, most of them have understood that sugars are bad for them, but it's the addiction to sugar, which they don't understand. They know that it's bad for them, but they still want to have it, right? So even if the patients, the F&B department, if they're coming in, they're not supposed to get any of the Tetra packed juices. They can get buttermilk, they can get lemon water if they want. They're also salted, but not sugary. So no sweets allowed. Once they're shifted out of my department, I really don't have much control. But yeah, I hope this practice just, there'll be somebody in the administration who's going to catch up and understand something is happening, something needs to be done.
We're going to sort of segue this into a broader conversation now, Ankur, about where you live. You've touched on it earlier. India, a population
Yeah.
of over 1.4 billion people now. And, small change can be, you're affecting a lot of people. And your outlook is that it's great to get to people. You've started the Desi EM Project as a podcast to get the information out there. And the fact is, as you often say, we've been misinformed for many years. But the importance for you is to also touch doctors, because then doctors will touch an amazing
Yeah.
amount of other people, especially where you live. The challenge for you, as you talked about, the Indian diet, and I'm going back to when I was a vegan, I ate a lot of Indian food because, let's face it, it was easy to do. There's a lot of vegetarianism and veganism in the Indian diet inherent. So I would often go out to Indian restaurants and have my rotis and rice and samosas and pakoras and things like that. And
Yeah.
it's bringing me back now, the memories. But this must be quite a challenge for you, especially because of where you live. How are you finding your other physicians that you work with? Are they starting to take notice of how you've changed your diet and the results? I mean, folks, let me just say this. I talked to Ankur offline about his before and after picture. I'll send you the link. We'll talk about where you can find him on Instagram, but it's amazing, his transformation. And let me stop there, Ankur. What are your thoughts on that?
Yeah, I mean, it's not easy, because the doctors are intellectually really high up there, right? And then, no offense, but there's an ego which one needs to go through, right? Because what we feel is what we've been taught and what we've been teaching and preaching all these years is actually correct. But to take a back step and accept the fact that, we were not trained in nutrition, there is something else going on. All of these diseases can be linked to nutrition and can be reversed. It's actually going to take some time. So, once I started this, like I told you, the head of my department got into carnivore in probably December. He's lost about 10 or 12 kilos till April, and he's off his antihypertensives in like about a couple of months. So he understood. He speaks the same language now to the patients that he sees. He speaks the same language to his family members who come and ask him for help, and he's starting to understand that he's put his brother on a carnivore diet because his HbA1c is what I think 11 or 12, and he's just about 43, 44 years old. So he's taken notice of that, and he's making he's making changes in the families that he touches. My team of residents, since they're residents, they have different shifts. It's very difficult for them to go carnivore, but they're trying. But what they've understood is they ask their patients their diet, what are they eating? And even if my residents don't eat full on carnivore, they're trying to tell the patients, that what you've been doing is not correct. Try and think about meats, listen to this podcast, go onto this Instagram handle, and, trying to share that. There are a few neurologists, like I told you about. He's a vegetarian, so it's going to be very difficult, but he's understood the importance of the nutrients that he's missing out on. Another really nice anecdote is one of my friend's mother's calcium scoring was done today when I told them to get it done. She's supposed to be a pure healthy vegetarian, but she's been in the hospital the past couple of days with UTIs and a lot of cervicitis, cystitis, dental issues, eye issues, some bony issues, joint issues. So yeah, obviously she's oxalate loaded. And I put her on the nephrologist. He's a young guy. Once he saw the calcium scoring, which was high, so she had calcium. It's not supposed to be there because her lipid profile is absolutely normal, right? And then he understood. He told my friend, I think there's something wrong with the diet, right? And he's the one who's also treating my uncle for his renal tumor. He's got a kidney tumor. The uncle whose diabetes I reversed after 25 years of medications that he was on. His hypertension's gone, his diabetes is gone. He's off all the three medications, and took about 2.5 months. And they're full-blown carnivores now. His tumors reduced a little bit. His lung metastasis has disappeared. His mediastinal lymph nodes have reduced in numbers and sizes. So he goes into ketosis when he has to get his immune therapy, and the rest of the time he's carnivore. So yeah, so the nephrologist also understood. I spoke to him how carnivore actually helps with kidney disorders also. I mean, my uncle had a creatinine of 3, which is down to about 2 now. His urea was in the 80s and it's down to about 60 now. It's going to be there a little bit because of the renal tumor. So, still working out fine. He didn't require dialysis. So he's also understood that. But yeah, we're trying to touch as many patients as possible. And the doctors share my podcasts everywhere. And we've tried to do some research in our department. If you want to, we'll talk about that a little later. It's quite interesting.
Absolutely. Love to hear about that. Ankur, the next question I have for you is again, you just touched on that. And I'm glad you raised it because I know now, I mean, you know my journey. I found out about the carnivore diet in a roundabout way because I found Sally Norton first and about oxalates and realized that plants are not these benign things. They protect themselves and their seeds through these crystals, oxalate crystals. And as you know, I was bombing myself with the most heavy versions there are available. We talked about it earlier. The challenges, and I can imagine in India, is that, as we touched on, that the Indian diet is inherently carb centric, but also very oxalate heavy as well. Now that you look back on your emergency room days prior to carnivore, do you think about all those folks that potentially had oxalate toxicity issues? And what have you seen now coming through? You just touched on one example.
Yeah, of course. I was on the plant-free MD a few days back with Dr. Chafee, right? And I told him the same thing. Every person I know, friends, family, acquaintances, colleagues, employers, employees, there is at least one member in that family who has a metabolic syndrome. Absolutely. So that's how prevalent it is. If people actually think, if they start thinking in their ways, in every family, there is one person who has a metabolic syndrome. Why is that happening? And this is the person who's obviously been tested. There would be others who have not got themselves tested, right? And it's really, really prevalent. So with oxalate toxicities, we get a lot of patients who have recurrent UTIs. We get a lot of patients with renal calculi and ureteric calculi. That's one of the most common symptoms and disorders of oxalate toxicity, right? A lot of people have calcium oxalates. What they don't understand is the doctors also tell them it's because of the calcium. It's not because of the calcium. It's because the oxalates are chelating that calcium from your bones and every other tissue and pumping it through the kidney. And that's where they form the calcium oxalate crystals, right? And then that gets blocked. So I've had a few patients who used to have a lot of almonds, peanuts, cashews, I think, spinach, juicing themselves, and they used to have like 10 centimeter. Yeah. So no, sorry, 10 millimeters. So that's approximately 1 centimeter, right? So that's really big for your ureter. And we have a lot of patients coming in with that. And, earlier I used to tell them, have a lot of water, avoid tomatoes and all of that. But now I tell them, tell me what you eat exactly, as much as close to, the correct information as possible. And it turns out that they have a lot of oxalate loaded foods. And I mean, I do advise them to cut it off. But I don't know if they actually do, because then it's very difficult to follow up on the patients who come to the emergency room and then leave.
And again, thank you for touching on that. And that leads me perfectly into my next point. We're dispelling some misinformation, let's call it, about oxalates and how they present and what they're caused by, etc. Let's go into another one. We again touched on it earlier, but I'd like to delve into it a little bit because you have some great ways of explaining it. And that is the cholesterol myth. As you know, I had Nina Teicholz on and we went into some detail, but I know folks want to hear from a physician and the doctor about, his thoughts on this myth surrounding LDL cholesterol. You talked a little bit about your own journey, Ankur, earlier, but it's really the trigs to the HDL ratio that's of most importance, isn't it? And what about if you present with a high LDL? What do you say to people?
I tell them to just take it easy. A lot of people tell me, they send me their lipid profiles and they're like, my LDL is high and my cholesterol is high. I'm like, first of all, forget about your total cholesterol. That's just basic maths. So leave that out. You look at your LDL, it's not going to be a problem. What the studies have shown is higher the LDL, lower are the risks for cardiovascular diseases, lower is the risk for strokes, lower is the risk for mortalities or all-cause mortality also. And even the studies where HDL was looked at, it was the HDL which was causing the problem. The low HDLs were causing problems, not the high HDL. So people need to understand that if you have a high HDL, and the only way you're going to get high HDL is by having your meats and your eggs, right? And don't worry about LDL. I mean, there are a lot of people talking about extended lipid profiles or ApoA and ApoB, but I think if you're having your meats, you're not having your sugars, you're not going carb loaded, you don't have to worry about your ApoA and ApoB. So And if you're really worried about your LDL, get a calcium score done. You'll know what's wrong with you. So if your calcium score is high, then you need to look into what else are you eating with your meats, right? So you need to know if you're having sugars or not, or carbohydrates or not. That's the one that's going to cause problems. So yeah, I mean, it's always been a myth. We all know about Ansel Keys and the diet heart hypothesis. I'm not going to go into that. People can listen to a lot of podcasts regarding that. A lot of people have spoken about. Nina has also spoken about that on your podcast. I loved that chat. It was absolutely brilliant. I just ordered her book also. I have to go through that once. Yeah, so yeah, so that's going to happen. But yeah, I mean, it is actually a myth. There are a lot of other things that you need to look at, and not just the lipid profile. And so for the people out there, anecdotal again, I got my CT scan done last year, and my calcium score was 0, and my LDL levels are about 250 or 260. My HDLs are in the 70s. My triglycerides are like around 100, 105. It's still on the higher side. I still want to get it lower because I think I'm a coffee hyper responder. So yeah, just want to yeah, I'm gonna work on that. But my TG to HDL ratio is just like 1.6, so that's not too much of a problem. I know I don't have my sugars. I don't I my there I don't have any inflammation anymore. And you can see that in my before and after pictures. When I look at that, I can see the inflammation. And I think you can also understand. Once you get into this kind of a fitness zone, you can see inflammation walking around you, right?
100%. And I'm glad you touched on this subject of inflammation because it's an important one. Because let's be honest, I've heard you also talk about it, and I know that inflammation can be a root cause of metabolic disease.
Yeah.
And also that LDL you have to really be concerned. It's the oxidized LDL, isn't it, that causes the plaques?
Yeah.
Where is this oxidation coming from? Is it from things like sugar, maybe seed oils, all that stuff?
Yeah. The seed oils, the sugars, they're the ones which cause the inflammation. I mean, I mean, it's good that you touched on to seed oils. That's another evil, right? So usually I tell people, if you want to get healthy, have your meats, avoid junk, avoid processed, avoid sugars, avoid seed oils and unnecessary fibers, right? And the oxalates will go by themselves there if you have this. But yeah, I mean, people need to know that seed oils like, soybean, safflower, sunflower, cottonseed, all of them, all the refined oils, they have a lot of linoleic acid in them, which is an omega-6 fatty acid. And they actually disrupt a lot of the processes in the body, right? Which includes oxidative stress. So they create a lot of oxidative stress, and a lot of waste products are again produced. They also interfere with the autophagy, and they also interfere with glycation. So yeah, they also lead to that. And yeah, so I mean, a lot of oxidation of the plaques happens because of the seed oils and the inflammation that they're causing. So what people don't know is cholesterol was always meant to be a healing product of your body, right? Every grain in your body, every cell membrane is made of fats. Your thyroid hormones made of fats and cholesterol. Your sex hormones are made of fat and cholesterol. So brain is 60% fat. Your myelin sheath around your spine, your spinal cord, and your nerves are all made of fats. You need those fats. That's the job. And when you have inflammation in the body, the fats are actually sent to put a balm over them, to actually heal it. But then if you keep oxidizing it and keep eating your seed oils and you keep eating your sugars and your carbs, it's going to oxidize that. And that's when, spasms take place, and you can have heart attacks.
Now that we've dispelled a few of the myths, I also heard you say, which again makes perfect sense, that good physical health plus good metabolic health equals good mental health. Now with that being said, the folks are listening to you, they're like, okay, here's an emergency room doctor. He's talking about the significant changes, not only one that he's seen with himself. He's on a carnivore diet now, and he's also seeing changes with his patients. What does a typical day of eating look like for you now, Ankur? Now that you've changed your diet, what are you eating each day, and how many times, etc.?
So yeah, before I go to work, I have eggs at home, and that's about 3 or 4 eggs. And that's about it. My lunch is basically either chicken, pork, buff. We don't get beef over here. Prawns or fish, mutton. So that's goat meat or lamb meat. So one of the dishes, any one of those, I have like about 400 or 500 grams in the afternoon, and then I repeat the same for dinner, and like, as carnivores, we have so many recipes, so many different styles that we can cook in, and all the food is cooked only in either ghee, butter, or virgin coconut oil. So if you've I don't think you've been to India, so the South Indian dishes, they taste really nice because they're all cooked in coconut oil. So the virgin coconut. So that's another recipe that we have, right? So we can, just for a change of taste, also we use the virgin coconut oil. That's also very high in saturated fats, which is good for us. Yeah, so I mean that's basically what we eat. So we do eggs, chicken, goat, lamb, buff, pork, fish, and shrimps or prawns or lobsters.
Please excuse me, Ankur, but what exactly is buff? I apologize. I don't know. What is
That's
that?
buffalo,
Ah,
buffalo.
got you. Okay, awesome. Well, if you can give some tips for people that are or want to start out on this way of eating, when you transitioned, what are some of the things that you used? I know I've heard you mention things like eggs and soups, right? Did you start that way? How did you transition into a more carnivore diet from the keto? I know it was a little easier for you because you're keto first.
Yeah, it was easier for me because once I started cutting down and I went to keto, the first things I stopped was all the breads. I was still having my rice, but I was counting the amount of rice I was having, so I could gorge on a lot of rice. When we get like the mutton curry made, I could eat a lot of rice, and that's what it does. I mean, once you get into eating rice, you can actually go on and on and on. It's like that. But yeah, I mean, it wasn't very difficult for me to move into a carnivore. I just shut out everything else and started having the meats that I wanted, and it was just the meats. But I've had a few friends, family who were finding it a little difficult to understand how to do and what to do. So I told them to cut it off slowly. Obviously, cut off the junk food and the processed food was the first thing to go. Just don't keep it in your house. And stop offering it to people. I don't keep it in my house. So if people come in for a party or something and they want to eat something, snacky with some of their drinks or something, so they get the meats. Some vegetarians also get maybe some cottage cheese or something. But yeah, so I mean, people can start off with some soups, like you mentioned. Chicken soup's really good for them. It's easier for them to make that. Eggs, obviously, bacon is something which is easy for them. And then I send them links of recipes. Sausages is something that they do for breakfast. That's a little easy for them. And yeah, and I basically let them know that, do your Indian cooking if you really want to. That's not a problem. There are a lot of Indian recipes. You just have to change the oil. Instead of the refined oil, just use ghee to cook. And there are a lot of recipes that we have. And yeah, I think they've adopted quite well, and they're doing that. It's not a problem.
Ankur, let me just ask you this question that I didn't actually have scripted prior, but it was of interest to me. Coming from that Indian food background, of course, so you're being from India, but when you transitioned over, do you now look back and think you may have had any issues with oxalate dumping? And are you keeping any oxalates in your diet currently at all? How's that working for you?
I'm not sure I had oxalate dumping. I definitely got oxalate toxic, and this I found out retrospectively because when I was cutting down my weight, I was doing oats and oatmeals every morning, thinking that that's the healthy way of going around, trying to cut my weight. And yeah, I was calorie counting and all of that. That was happening. And then one fine day, for at least a year, my jaw started clicking, my TM joint started clicking. I would eat and just cut, 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 cut. That's what's gonna happen. I'm brushing and again, it's just clicking all the time. And I couldn't figure out what the hell was happening. And I went to my facial surgeons, and they gave me a few exercises to do, which obviously didn't help. And I was like, I don't know what the hell is happening. I was just scared that, I don't end up with a lockjaw or something, and then, I have to get it maneuvered and get it reduced and all of that. But then when I went full carnivore, obviously my oatmeals went out. And in a month, I figured that clicking just stopped automatically and never came back. Then I realized that it was the oxalates that might have got crystallized and collected in my TM joints, and causing that friction and the clicking. There is no other logical reason for it. Once I understood about oxalates and read up on the research and how they go and collect in your joints and cause different arthritic changes also. and this is probably it was all oxalates. But yeah, I never had an issue with dumping because like I told you, I was always a very hardcore omnivore. I would, so basically in India, even if you're an omnivore, you would end up eating meats maybe once or twice a week, or maybe once or twice a month, and still have them with all the carbs. I used to still eat meats every day, at least a meal every day. So yeah, so I don't think I was too oxalate toxic for the dumping, and I think that only happened over a year. So I would not have had oxalates for many years. This was just the 1 year that I did with oats every day, which caused the symptom. But then again, this is just in 1 year that happened to me, right? Imagine somebody who's been having it for years. I can't imagine what they went through once they got oxalate toxic. You went through the same over so many years that you were eating, and I cannot actually imagine what you went through. You already told that on the Desi EM and a lot of other podcasts. People know what you went through, but yeah, I mean, going through it is something else.
It sure is. And I feel for those that, like myself, realized that they had been misinformed to the point that they're being caused so much pain now and anguish. Just interesting, recently, I told this on another recent podcast that I just recorded that, I've cut out dairy, and dairy was a big part of my diet, Encore, as I transitioned, because binding those oxalates through the calcium in dairy was very helpful to me, getting additional dairy in and calcium in because I had been lacking for so long on a vegan diet. I actually removed dairy because of Dr. Georgia Ead's new book, Change Your Diet, Change Your Mind. And I found benefit. I noticed my brain fog had been ticking up as soon as I had some dairy. I'm experiencing some benefits there. But interestingly, I initially started having blueberries and bananas as my oxalate fruits because I swore down I was never going to touch another vegetable. I've recently added bananas back in. They're in season here, so that's kind of appropriate. And I had gotten my rhomboid pain recently, which was rife in my body throughout my years as a vegan, where acupuncture, massage couldn't touch the shoulder pain that I had. It would keep me up at nights. I had so much pain. As soon as I added a few bananas back in my diet recently, with, bananas can be medium and sometimes even high, depending on the ripeness of the oxalates, it disappeared within like 3 days.
And by rhomboid, do you mean the rhomboid knots that people get? I've been undergoing physiotherapy for the same in the last 1 week. So probably, yeah, that's a part of the dumping, probably.
Absolutely. And
And
I tell you how I know, Encore, is because when I saw Sally at KetoCon last year, she saw me fidgeting with my shoulder. And
ah,
she was like, do you have this rhomboid pain right in the top, like a knot that comes that like acupuncture, massage can't touch it? And I was like, yeah, why? She's like, I had that. That is definitely oxalate dumping, and you need to probably increase your oxalates because acupuncture, nothing will touch it. And as you know, it's painful, man. It can get really irritating.
so yeah, I've been having this problem for the past week or 10 days. I've been undergoing physiotherapy. It's much better now, but then it still flares up a little bit. And I've been doing my exercises. The only oxalates that I have is my tea with a little bit of milk. That's in the evenings that I have. But now that you mention it, maybe I'll add some fruit and see how it helps. Yeah,
Yeah,
it's right. It's right here. Yeah.
that's the one, buddy. I'm telling you. And it is so annoying because, it just is constant. It was constant. I was like, I can't sleep. And then I was like, let me add these bananas back in with my blueberries just in the evening. That's the only oxalates that I really have. I don't have anything else. So I have about a half a cup of blueberries and half a local banana that I slice up. And 3 days later, I was like, wait a minute, that's gone. And it has not come back. Like it was there all the time. So, hey, I always say experiment and see what works. So I'll be interested to hear what you say.
Yeah, I'm gonna try this for sure because I remember I've heard Sally a lot of times. Oh, she's also coming on Desi EM Project this month. Yes. Yeah. So and I remember her saying in some of the podcasts and even in a book that dumping can happen even years later, I mean, probably in the start you don't get any dumping symptoms, and then it just comes up one fine day in the next 4 or 5 years, and it could be any of these vague symptoms. And that's something I was discussing with another friend of mine, Victoria. She's also on Instagram, goes by Low Oxalate Inspiration. And we were discussing about how oxalates can actually affect the placentas. And she had asked me, since I'm a physician, I have a lot of research access if I could find some more papers. And I was like, I've been trying to find a lot more papers, but the problem is everybody's posting everything on social media, but but they're not printing it in journals, not printing it in the scientific literature. And that's becoming a problem because we actually need more of these literatures, even if they're just case reports published. We need that. So I'm going to talk to Sally also. I mean, if you have cases coming in, if you have patients coming in, document everything and try and get it published. It's really important.
Ankur, let's put a pin in that conversation for a second. And as we start to wind down, I'd like to circle back to the issues that you've seen, especially in India where you are and in your emergency room. We talked a little bit about the presentations of the symptoms of things, but in particular, you've noticed that a lot, and you touched on it, a lot of young people are presenting now with metabolic issues into your emergency room. Why do you think this is happening these days? Is it because of all the seed oils, sugars we talked about? Why are so many young people presenting with these metabolic issues?
They're not taking care of their health. It's very simple. I mean, they're misinformed. They do not know what the right nutrition is. They all believe in the well-balanced, eat everything in moderation lifestyle. I mean, if you ask me what a well-balanced diet is, I won't be able to tell you. Even if you ask a dietitian what a well-balanced diet is, they won't be able to tell you. They'll probably make a balanced diet for you, but then that is not going to be the same for somebody else. And you don't know how much carbs are required for who, how much of proteins. We know how much proteins and fats we need, but carbs are not essential, right? I mean, our body makes it itself. So a lot of people don't understand this, and they're still young. Again, like I told you, they don't get tested, thinking either that nothing's going to happen to them because they're still young, or secondly, if something comes out, what are they going to do about it? I would rather go with the second ones because let something come out. You can still fix it. You can catch it, and not, I mean, something drastic happens and then your family comes and tells the doctor, what happened to him? He was so fit. How do you know he was so fit? You don't know that. I mean, it's not just physicality, right? It's the metabolic fitness is what is important. That's why we're trying to create awareness around, metabolically fit. You get metabolically fit, you'll be physically and mentally fit for sure, 100%. But that's what we're trying. And we see a lot of patients coming in. I remember I had like a 20 something come in and with some UTI or something like that. And I was just going through his chart and I'm like, you're diabetic, you're hypertensive, you've had a heart attack before, you've had a stroke before. What do you eat? He's like, I'm a pure vegetarian. He was a Jain, no offense to them. I'm a pure vegetarian. I don't even eat onion and garlic. I'm like, clearly it's not helping you. You're just 24 years old with all of this. There's nothing healthy that you're doing. And so because he was so stringent, I'm pretty sure he was not even having junk food or processed foods, right? Because you don't know what's in them. And we've started asking all our patients. We're doing a proper research and a survey. It's gone through the ethics committee and stuff. And we're asking every patient that comes in with any known past illnesses, be it diabetes, hypertension, hypothyroidism, all the metabolic syndromes, cancers, any one of them. And it's a long set of questions. Takes about 2 or 3 minutes to complete it. And it's not a food frequency questionnaire, basically. So we're asking them what kind of diet do you prefer, like vegetarian, vegan, whatever, carnivore. Not going to get many carnivores, I'm pretty sure. And if they're even over vegetarians or pescatarians or omnivores, it's supposed to again go into subsections and tell us how many times a week or a month on an average do they eat those meats, if they have meats, and are they accompanied by carbs or not? And then are they having the Nova 1, 2, 3, 4 processed foods? Which ones do they usually eat? And obviously their exercise, their smoking, alcohol habits, any drug habits, all of that. So it's quite comprehensive so that we can get all the confounders also. And trust me, we've got about 350 patients till now. 95 to 96% of them are vegetarians. They're the ones who are also exercising and don't have alcohol or smoking in their life, as per them. And there would be some bias because they understand that, if it might be wrong to take on smoking or alcohol. So that bias might be there, and we understand that. But then 95% of them are vegetarians, and the ones who are omnivores actually eat probably meats once a week. So out of 21 meals, they'll probably have just one meal of meat on an average, loaded with carbohydrates. So there is something that's going to come out of this research for sure.
That's amazing. Can't wait for this to come out. And again, kudos on all the hard work that you guys are doing. There's one thing that relates to this, and that's in terms of the metabolic syndromes that you talk about. And you also did a podcast on the Desi EM podcast about it, and that's ketoacidosis that presents. And some people get confused between ketoacidosis and ketosis. And I just want you to just highlight what the difference is and how ketoacidosis comes about. I know it's associated with type 1 diabetes initially, right?
Yeah, yeah, it's associated with type 1 and type 2 diabetes. So it's when you have really high sugars, and that gets converted into ketones and beta hydroxybutyrate. That's the one that we're talking about, and that leads to your body going into what we call acidosis, right? So your pH levels drop down, your sugars are really high, your bicarbs drop down, and this is basically uh, it's an illness, right? It's a symptom, and it's life threatening. So you really need to be managed really well over there, and it's because the patients who not taking their medications properly, that's like the most important cause for diabetic ketoacidosis, right? You don't take your insulin or your oral hypoglycemics, and your sugars shoot up. What people need to understand is when you're going into ketosis, you're actually not eating your carbohydrates, you're fasting, right? So your body is burning fat, and that's when it goes into ketones, your ketosis, and your body is burning that fat and utilizing those ketone bodies for energy. In diabetic ketoacidosis, there is no energy left. You're about to die if you don't come to the emergency department soon. So, and that's another thing that so that's what the basic difference for the layman. They need to understand at least this much. And I actually don't advocate to go into long periods of ketosis. I mean, you achieve ketosis once, you feel good, all of that, and then you eat, because we have access to that, right? You do that. And so about saving lives, that's what I try and tell people. Just help me save your life by not coming into the emergency department, and that's only going to happen once you reverse your metabolic syndromes. You won't need me or any emergency physician to save your life because of these syndromes. They're so prevalent right now. 60% of the deaths in India are because of metabolic syndromes. 60%. It's doubled over the past 20 years, from 30% to 60%. And that's quite insane. So you don't need me to saving your life if you just take care of your nutrition and your diet, and you reverse your metabolic syndrome. It's going to be it's really going to bring down the burden of healthcare in this country. There's so many people. You can all get healthy, but yeah, you just need to work a little bit on that.
Thank you for that, Ankur. That's amazing. And just as a side note, as you know, I'm from the island of Bermuda, so a tiny speck of a pin drop compared to the size of India. We literally only have 60,000 people here clinging to a rock in the middle of the Atlantic Ocean, I like to say. But if you can believe it, which I know you can, we have one of the highest incidences here of diabetes per capita in the world. And it's all to do with the diet that is here, that is very high carbohydrate, sugar based. And it's very, very sad, actually. And I hope, and I'm so grateful for you as a physician getting this message out there. Ankur, as we end out, the last thing before we find out where we can find you and talk a little bit about the Desi EM Project, your podcast, is I heard you say something quite profound on one of the podcasts, and I just wanted to pick your brain on it. And it was, intelligence is when you learn from your own mistakes, and wisdom is when you learn from other people's mistakes. I just thought that was so great. So I wonder if you could give some examples for the listeners of where you've had the intelligence and the wisdom now that you're a podcaster and host, and what you've learned.
Yeah, this was something I one of my seniors had told me. So we use that in emergency medicine, right? If you look at it, there are a lot of case reports, there are a lot of complications that can happen because of procedures that we do when we're trying to save a life, right? And these are called known complications, but then they're known because it's published, right? So I make a mistake while doing a procedure. I know I've learned from that. That's intelligence, right? But then I read up and I know somebody else had made another mistake, and I learned from that so that I don't make that same mistake, right? So that's basically wisdom. And uh, even on my podcast. So basically, I started this podcast off to basically train and teach more residents and the emergency medicine community regarding emergency medicine, the myths in emergency medicine, more of evidence-based best practices and all that. And obviously that I figured that emergency medicine is really closely related to the health of the community. If the community is well and healthy, it's not going to come back to the emergency departments. So then I incorporated nutrition, fitness, all of that into the talks that I want to do on my podcast. So yeah, I mean, that's what we've been working on. All my residents, we've been telling them the same thing. Anybody makes a mistake, share it, don't hide it, so that others can learn and not make the same mistake, right? So, I mean, everybody learns from their own mistakes, but what's important is how to learn from others' mistakes. And that's where the wisdom comes in.
Profound words. Ankur, why don't you tell the people where they can find you, not only online, I know you're on Instagram, but also where the Desi EM Project podcast is available to them.
Yeah, so the Desi EM Project is available on Spotify, Apple and Google Podcasts, and I think on Anchor also, which is an online portal. You can follow it over there and listen to it over there, and you can follow me on my Instagram on ANKSV. You'll be putting that in the show notes, I guess. I don't go too heavy into the social media world because I still have to save lives every day when we go to the department.
Dr. Ankur Verma, I want to say thank you for taking the time out today on that note, because not only do we appreciate you for the work that you're doing as a physician, an emergency room specialist, but we also appreciate you as that and putting out this information that you are and taking care of your patients in a place in the world that, quite frankly, you're moving against the tide, a big, huge tide of misinformation, but you're going to battle every day, not only saving people's lives, but battling the misinformation. So thank you for taking the time out. It's always a pleasure to chat with you, my friend.
Thanks a lot, James. It's been an absolutely a big pleasure and an honor to be on your podcast. Yeah, looking forward to more conversations.
Absolutely, Ankur. We're going to have to do another one, and I look forward to chatting with you again soon.
For sure. Yeah.
And that's a wrap on this episode of Carnivorist Chats. If you've made it this far, I want to say thank you for listening, and also thank you in advance for liking, subscribing, or sharing this episode. Thanks again to Equip Foods, Carnivore Snacks, and the Carnivore Bar. Don't forget to check the link in the show notes to get a discount on their products. Until the next time, be well.